Hello and welcome. Today we're diving deep into a genetic disorder that primarily affects the kidneys, but can also have significant effects on other systems, including the digestive tract. Alport syndrome. Alport syndrome is always caused by mutations in genes that provide instructions for making type IV collagen. These genes are SOHORA3, SIL44, and CAL-A5. Type IV collagen is a crucial structural protein found in the basement membranes of various tissues, including the kidneys, inner ear, and eyes. The specific gene affected and the nature of the mutation dictate the inheritance pattern or X-linked, autosomal recessive, or autosomal dominant. The absence or abnormality of type IV collagen in the glomerular basement membrane of the kidneys is the core problem in Alport syndrome. This weakens the membrane, leading to hematuria, or blood in the urine, and proteinuria, protein in the urine. Over time, this damage progresses to chronic kidney disease and eventually kidney failure. While the primary damage is to the kidneys, type IV collagen is also important in the inner ear, leading to hearing loss, and in the eyes, potentially causing lenticonus or retinal flecks. The digestive system can be secondarily affected by the kidney disease and medications used to treat Alport syndrome, leading to problems like nausea, vomiting, and loss of appetite. Alport syndrome affects approximately 1 in 50,000 people. Because it's a genetic condition, its occurrence is consistent across different ethnicities and geographic locations. However, the specific prevalence may vary slightly due to differences in genetic backgrounds and diagnostic practices. The initial sign of Alport syndrome is often persistent microscopic hematuria, blood visible only under a microscope. Over time, proteinuria, or protein in the urine, develops. Other common symptoms include progressive hearing loss, usually starting in late childhood or early adolescence, and eye abnormalities such as lenticonus, a cone-shaped protrusion of the lens. As kidney function declines, individuals may experience fatigue, swelling in the legs and ankles, nausea, vomiting, and loss of appetite, all symptoms related to kidney failure. Digestive symptoms like nausea are also common side effects of medications used to manage the kidney disease. Diagnosis of Alport syndrome typically involves a combination of clinical findings, family history, and laboratory tests. Urinalysis reveals hematuria and proteinuria. A kidney biopsy allows for microscopic examination of the glomerular basement membrane, revealing the characteristic splitting and thinning of the membrane. Genetic testing confirms the diagnosis by identifying mutations in the SOHORA3, CHL4, or CHL4I genes. Hearing tests and ophthalmological examinations are also performed to assess the extent of inner ear and eye involvement. Alport syndrome can be classified based on its inheritance pattern X-linked Alport syndrome, which is the most common form, autosomal recessive Alport syndrome, which requires inheriting the mutated gene from both parents, and autosomal dominant Alport syndrome, where only one copy of the mutated gene is sufficient to cause the disorder. The severity and progression of the disease can vary depending on the type of mutation and the specific gene affected. Currently, there is no cure for Alport syndrome. Treatment focuses on managing symptoms and slowing the progression of kidney disease. This includes using ACE inhibitors or ARBs to reduce proteinuria and lower blood pressure, which helps protect the kidneys. Regular monitoring of kidney function, hearing, and vision is crucial. Dietary modifications may be necessary to manage kidney function and reduce digestive distress. In cases of end-stage renal disease, dialysis or kidney transplantation are necessary. As Alport syndrome is a genetic disorder, prevention is not currently possible in the traditional sense. Genetic counseling is crucial for families with a history of Alport syndrome who are considering having children. This allows them to understand the inheritance pattern and the risk of passing the gene on to their offspring. Preimplantation genetic diagnosis, or PGD, is also an option for some families undergoing in vitro fertilization. The prognosis for individuals with Alport syndrome varies depending on the severity of the disease, the specific genetic mutation, and the effectiveness of treatment. Many individuals with Alport syndrome eventually develop end-stage renal disease and require dialysis or kidney transplantation. However, advancements in treatment, such as ACE inhibitors and ARBs, have significantly improved outcomes. Research is ongoing to develop new therapies that target the underlying genetic defects and slow the progression of the disease. Gene therapy and other innovative approaches hold promise for the future treatment of Alport syndrome.